What are local leaders supposed to do to protect their constituents when they live in an anti-science state? As far as the mayor of St. Louis goes, she had this to say about the Republican AG attacking her public health policy. Quote, "I wish that he would put more of his attention towards serving the people of the state of Missouri." Joining us now is the mayor of St. Louis, Tishaura Jones. Mayor Jones, good to see you again. Thank you for being with us tonight. You got a serious issue in your state and in your city. And it'd be one thing if you just had a serious issue and you put in the mask mandate and you encourage people to get vaccinated and we would get to the end of it. But you're actively fighting people as this COVID virus is once again attacking your state.
Yes, we're fighting people on two fronts. We're trying to get people vaccinated and to keep them safe. And that's what the people of St. Louis City and St. Louis County elected myself and Dr. Page to do. And it should be noted that Dr. Page is an anesthesiologist who works in hospitals. I have a 10-year career working in hospitals and health centers as a health administrator. So I think we know what we're talking about, but we're also following the guidance of the St. Louis Metropolitan Pandemic Task Force, made up of the leaders of our FQHCs as well as our local flagship hospitals. They have been recommending that we go back to a mask mandate for about a week now.
You and I talked right after you got into office. You've been in office for about 100 days now. Have you had to sort of do a little bobbing and weaving and changing how you're dealing with this? Because 100 days ago, 3.5 months ago, we thought we were in a different place with COVID. We were getting these vaccines out. We assumed that, a lot of people would take them. There was difficulty getting it. And now you've got an entirely different problem to solve.
Yes, absolutely. We thought that people would that vaccination rates would be higher. We thought that our leaders would be more bold and forceful in recommending that people get vaccinated. But in St. Louis City alone, we are looking at another problem related to 80% of new cases are in the African-American community, and only a little over 23% are vaccinated. So we have a whole different issue to deal with vaccine hesitancy amongst minority populations.
How do you deal with both of those things the same or differently? Vaccine hesitancy in minority populations versus sort of anti-science conspiracy theorists?
Yeah, we have to deal with it all at the same time, or else we will not get out of this pandemic. We are looking at a third surge in the state of Missouri, and we have to address vaccine hesitancy. As far as myself and my family, all of us are vaccinated, including my 75-year-old father and my 13-year-old son. So, we follow the science, and I hope that others will follow the science as well. It is safe to get vaccinated, and it's your best defense against the horrible side effects of COVID-19, up to and including death.
What's the fight look like on the ground? Let's get outside of the political fight that we saw in St. Louis County, or the attorney general suing you. Are you finding that you're able to sort of challenge the resistance on the ground? Are people at least abiding by the mask mandates?
Yes, we're finding that people are abiding by the mask mandates in St. Louis City. And we're also finding that we have to meet people where they are when it comes to vaccine hesitancy. So just last Friday, we took our mobile vaccination unit from the health department to a community resource fair, and we'll be taking that mobile vaccination unit out everywhere we can to actually meet people where they are and offer them vaccines in communities where they live.